My name is Paul Nourbash. I'm a senior orthopedic surgeon here at Barrington Orthopedic Specialists. I'm board certified in orthopedic surgery. In addition, I did a 1-year fellowship in surgical treatment of artificial hips and artificial knees. The purpose of this video today is to talk about 3 conditions that affect the pelvic region. These have a lot of overlap, and it's confusing to patients what they have wrong with themselves and who should they see to get care. I hope that this video helps you in getting correct treatment and finding the appropriate doctor. As I mentioned, my specialty is hip and knee replacement surgery. So let's start out with hip arthritis. A lot of patients that come to see me are quite surprised to find out that the hip joint is in the front of the pelvis. Actually, I would describe it as in the groin, up here. The patients that have a bad hip have restricted range of motion of the hip joint. How does this affect their daily activities? Well, some of them say that they walk with the foot pointing outward. Some patients say they have a lot of trouble putting on their shoes and socks. And other people say that when they sit on the ground, that they can't sit with their legs crossed. At least they're not sitting with both sides looking the same. The side where the hip's affected is not looking the same as the side that's normal. So if you have any of those symptoms, groin pain, trouble putting on shoes and socks, trouble sitting cross-legged on the floor, you may have a hip problem, and you can come see me or someone that specializes in treatment, surgical treatment of the hip. The second condition that we frequently see in this pelvic region is on the side. We call that the lateral side of the pelvis. There's a structure that starts in the pelvis and goes all the way to below the knee called the IT band. It goes from the iliac crest to the tibia bone below the knee. The IT band, when their muscles are weak, can become quite inflamed. People call it IT band tendinitis. Some people also refer to this condition as greater trochanteric bursitis. Well, the good news here is that this condition is treated non-operatively. You don't need to see a hip joint replacement specialist if you have a non-operative condition. Pretty much all orthopedic surgeons can help you take care of this condition, and we do so with physical therapy and anti-inflammatories. The third condition is probably one of the most trickiest to explain to everyone, but it's very common in our society. And that involves the spine. If you think about your body and what you feel, all sensation in your body travels through nerves. The feeling that you have in your big toe travels from the toe to your brain through a nerve. It enters the spinal column, and when it's in that spinal column, it could be subjected to pinching, a disc herniation, or osteophytes that can irritate that nerve. If a nerve is irritated along its path to the brain may misinterpret that information and believe that there's something wrong with the toe, even if that toe is perfectly fine. This is very common in the pelvic region. Patients complain of pain posterior on the pelvis that may wrap around to the groin. It doesn't affect their ability to put on shoes and socks. It doesn't affect their ability to sit cross-legged. But when they sit in a chair, sometimes that puts a lot of pressure on their spine and they feel worse. When they extend their spine or look back at the ceiling, looking up, they sometimes feel worse. When they bend their spine to the sides, that may also worsen their condition. What I'm describing here is that moving your spine makes this sensation feel worse. If that's the cause of your pain, then I would strongly recommend that you see a specialist that treats spine conditions, and they can more readily help your condition. Once again, the hip is located in the groin, in the front of the pelvis, and patients that have a lot of trouble putting on their shoes and socks should get it looked into. Make sure that there's not something that we can treat and make your quality of life much better. I hope this video helps you. Have a good day. Thank you.